Welcome back. This is part 3 of today's lecture. So now we're going to talk some more specifics about the psychosocial factors that actually affect psychological well-being in the workplace. And a lot of this information comes from the Guarding Minds at Work website. Remember, I showed it to you earlier. It was created by Great West Life in collaboration with Simon Fraser University and the Canadian Mental Health Association. So they talk about psychosocial factors being elements that impact an employee's psychological response to work and to their work conditions. Depending on the interactions, these can either be healthy and restorative, or they can create psychological problems within the workplace. Psychosocial factors include the way work is carried out and the context in which the work occurs. So, like your relationships with your co-workers and with your manager and with your clients, and also some aspects of the environment, the physical environment, are influenced by psychosocial factors, and we'll see more about those in a minute. According to the Guarding Minds at Work authors, there are 13 psychosocial factors. And that website actually walks you through the different psychosocial factors and provides assessment tools and recommendations and resources to address each of those factors. So it's a very comprehensive website, and I encourage you to spend some time looking around in it. There's a general overview, and then it breaks it down into the 13 different psychosocial factors. These factors were developed out of the evidence base, so we know that the work is reliable and the tools are reliable. I'm quoting from their website now. In the Guarding Minds at Work assessments, lower scores will indicate greater risk of employee psychological health and organizational psychological safety. So what you're aiming for are high scores. So when you're using those assessment tools that I'll show you in a few minutes, you're trying to achieve higher scores, and interpreting lower scores as flags, things that you really need to prioritize and start to address quickly. The higher scores indicate areas of resiliency that will help to sustain people within the workplace. So the factors are obviously interactive. They're not in isolation. They low factor in one area may help to create more problems, whereas higher resiliency scores and sustainability scores are I'm starting to stumble around here in the middle of this, aren't I? So I think I should just go on and I should show you what I'm talking about. Okay, so this research was all done in Canada as well, right? The resource was developed in Canada, so it's very relevant to our needs. So here are the 13 psychosocial factors they talk about. Psychological support. Do you actually have support from your coworkers and from your supervisors? Do you have an organizational culture that values honesty and fairness and trust? And those are easy words, but not necessarily easy values to demonstrate in some workplaces. Is there clear leadership and expectations? Do people treat each other with civility and respect? And I think we all have examples of when we have seen that not in action in workplaces. Is there psychological competency and requirements? Is there a good fit between the employee's interpersonal emotional competencies and what they're actually asked to do? Or is someone who is really not suited to a job being forced into a situation that will cause them a great deal of stress and discomfort? Is there opportunity for growth and development? Is there recognition and reward? And that doesn't just mean monetary reward, right? There are many ways of rewarding people that they find engaging and motivating, and not just the salary. Is there an opportunity for involvement and influence? Do people feel that they have some ownership and some influence in the decisions that are made? Is there appropriate workload management? Are tasks and responsibilities assigned appropriate to the amount of time that's available? You want to look at the factor of engagement. Do people feel engaged? Are there things within the workplace that motivate them to come to work and enjoy their work and do a good job? Is the workplace balanced? Is the recognition that there has to be some fairness between work and family and personal life? Are there psychological protective factors in play? Do people pay attention to psychological safety? And lastly, is there protection of physical safety? Because we all know that physical safety risk can also take a huge toll on your well-being, your psychological well-being. So if we put this in the OT context, where would you categorize things like, now here would be having a class discussion if you were all together. So you just have to discuss this hopefully amongst yourselves or in your own mind or with a family member or one of your other classmates. Where would you put issues like employment security, organizational restructuring? There's a lot of that in healthcare. Unfilled vacancies, a lot of those, insufficient space, the physical space itself, a lack of privacy. People talk about that all the time. They feel they have no private area to just be with their own thoughts or to even make a phone call to a client that can't be overheard. Where would you put inexperience and role diffusion? The things that people are being asked to do things that they feel are not part of their role. Team members' lack of understanding of the OT role. The fact that there are very few organizations that still have break rooms or a coffee room or anything like that so you can get away. Noisy work environments. Where would you categorize fear of disclosing mental health diagnoses? Where does that fit? That people feel this may stigmatize them. A very good example right now is what's going on with the emergency responders and PTSD. That's been in the news a lot lately. People fearing to disclose that because of concerns over actually losing their jobs, even though when they are receiving treatment and have been cleared for work. Things like salary negotiations that go on and on and on, so people have a high degree of uncertainty about the financial and the benefit aspects of their jobs, and the stigma of mental health conditions. So those are all things that are part of the OT's work world and that would fit within those psychosocial factors. If we take a closer look at the Guarding Minds at Work website, here's an example. And I would encourage you to pause the presentation here and actually click on the Guarding Minds resource and go there and take a closer look, because there is so much. There is no way I could possibly cover it all. You'd get overwhelmed. But just tuck this away and keep it in your mind that these resources exist. There's information about how to assess each of these factors, and then resources about how you would start to address them within an organization. So, of course, you don't do this as an individual OT. You bring it to the attention of your workplace health and safety committee, or to your manager, or to the other stakeholders, right? This is not your job to solve. So here's one example, organizational culture. If we go into the resource, and here's the assessment that they use, right? Please answer the questions below with respect to your workplace. So you would take a survey of all the employees in a workplace and then compile the information. All people in the workplace are held accountable for their actions. People at work show sincere respect. Difficult situations at work are addressed effectively, and so on. And then the score is provided and some indication of whether you should be concerned about the score or not. And then this links into resources to help address the problem if that indeed gets identified as a serious concern. Like I was saying, there's recommendations then so you've done the assessment, it leads you into the recommendations. This one has to do with organizational culture. So say training and development came up as an issue, then there are some options that an organization should discuss about, well, how can we address this issue? How can we promote psychological health and safety in our workplace? How can we prevent problems from happening? And here's one example. Training and development provide opportunities for teams to learn and develop together in order to strengthen relationships things like team building exercises, but they talk about the work environment, they talk about communication, they have strategies around policies. It's very important that policies are in place, right? You can't just trust that all of this will happen. Now, the United Kingdom approached this in a slightly different way. They developed management standards for mental health in the workplace, and they have a framework that talks about 6 management standards. So they talk about the demands of the workplace, control, how much say does a person have in the way that they do their work, support, how much encouragement and mentorship and resources available to people, the role that they play within the organization, and is it a conflicting role? Is it well integrated? Change, how much organizational change is occurring and how is it communicated? Not just that it happens, but how do people learn about it and how much influence do they have in it? And lastly, relationships within the workplace. So they break these 6 categories down and have a standard developed for each one, and then talk about what elements would need to exist in the workplace to meet that standard. So here's an example. If we were looking at demands, and this includes issues like workload, work pattern, work environment, standard practice should be that employees indicate they are able to cope with the demands of their jobs, and systems are in place locally to respond to each individual concern. And then they go on to say what should be happening to make sure that this is achieved. The organization provides employees with adequate and achievable demands in relation to the agreed hours of work. So there is some way to measure and monitor the amount of work being requested in relation to the actual hours that are available to do it in. People's skills and abilities are matched to the job demand. Jobs are designed to be within the capacity of employees, and employees' concerns about their work environment are addressed. So there should be tools that would monitor all of these different aspects so that the standard could be met. Okay, so talking a little bit more about demands, aspects of the work environment. Risky environments, this is very interesting stuff. Like one of the aspects of the work environment is whether it is safe to disclose if you have a psychological health issue or not. And Sandra Mall is an occupational therapist at McMaster University, and she actually did a very, very interesting study about why we do not disclose at work, and also how our coworkers collude to make sure that disclosure doesn't happen. And she calls it the web of silence. And we don't have a lot of time to go into it today, but it is fascinating reading it. I would encourage you very much to go and take a look. Some of the key aspects for occupational therapists is because we are a regulated profession, you have an obligation if you become aware of someone having problems that makes them unsafe within the workplace, you have an obligation to address that issue. So it becomes very problematic because you also potentially have a social relationship with that individual, and you don't want to be the person who goes to the college to say, I believe that this person is not fit for practice, or to go to your manager and to bring up the issue. So there are all kinds of things that happen, and there's a lot of stigma attached to this. And anyway, it's a fascinating read, and I would encourage you all to go through it because it's very challenging and it makes us think a lot about ethics and our duty to other people. And yeah, I think I'm going to stop talking about that for now. But basically, she concludes, I mean, really, we have a lot of silence in our workplace and leads to inaction. Now, she doesn't apply this directly to occupational therapists, but the link is definitely there. And she is an OT, so she's speaking from a healthcare provider perspective. More about demands, the organizational culture, what are the social norms, what are the perceived expectations? Like, do you have a culture that says, oh, yeah, of course, if you got my email on the weekend, you should have responded to it. What's the matter with you? Do you work in an organization that values quantity versus quality? That can cause a great deal of stress to people, right? That feeling like you're just brushing the surface, but boy, you tick the box because, okay, I saw 20 people today, regardless of whether you did good quality work or not. Demands in terms of face-to-face interaction. This can be quite exhausting, the amount of intensive in-person time you spend in the workplace. And so that can also have a bearing on our ability to be psychologically healthy within our work settings. And also recognizing that different coworkers have different character traits. Some people find it very engaging to work their socks off, and they blur a lot of work and home boundaries. Other people find that overwhelming, but then if you have the two collide within one work setting and one person is rewarded from actually being almost work addicted, and I hope you read those reports that I posted for you and I referred you to. And the other person almost feels penalized for just doing the regular expectation, right? So you can have those kinds of dynamics that get set up in a workplace. And these are very interesting journal articles to take a look at if you want to pursue more information in this area. And when you're doing your presentations, come back to some of these resources, right? They'll be very helpful. What else about workplace demands? Well, let's not forget those very simple things like the physical environment. Things like how much blue spectrum light are you exposed to? Because if we don't get sufficient blue spectrum light, it does take a toll on our mental health. And we know that because of seasonal affective disorder and all kinds of other research studies. And this is just a little graph from a study that was done that shows how limited amount of blue light exposure people get depending on the different climates that they live in, the different parts of the world. And also, so it's a big issue for us here in Alberta, right? Because we're more northern and we have long winters and it's dark. So something to pay attention to.